Hey, Alpha Nurses, and Licensure from alphanurseguide.com. This is 20 practice questions. Without the way, let's get started.
Question 1. The nurse is reading the healthcare provider's progress notes in the client's record and sees that the HCP has documented insensible fluid loss of approximately 800 milliliters daily. Which client is at risk for this loss? 1. Client with a draining wound. 2. Client with a urinary catheter. 3. Client with a fast respiratory rate. 4. Client with a nasogastric tube to low suction. The correct answer is 3. Client with a fast respiratory rate. Rationale. Sensible losses are those that the person is aware of, such as those that occur through wound drainage, GI tract losses, and urination. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Question 2. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at the least likely risk for the development of third spacing. 1. The client with sepsis. 2. The client with cirrhosis. 3. The client with kidney failure. 4. The client with diabetes mellitus. The correct answer is 4. The client with diabetes mellitus. Rationale. Fluid that shifts into the interstitial spaces and remains there is referred to as third space fluid. Common sites for third spacing include the abdomen, pleural cavity, peritoneal cavity, and pericardial sac. Third space fluid is physiologically useless because it does not circulate to provide nutrients for the cells. Risk factors include liver or kidney disease, major trauma, burns, sepsis, wound healing, major surgery, malignancy, malabsorption syndrome, malnutrition, alcoholism, and older age. Question 3. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for fluid volume deficit. 1. The client with cirrhosis. 2. The client with a colostomy. 3. The client with heart failure. 4. The client with decreased kidney function. The correct answer is 2. The client with colostomy. Rationale. Causes of fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, ileostomy, and colostomy. A client with cirrhosis, heart failure, or decreased kidney function is at risk for fluid volume excess. Question 4. The nurse is caring for a client who has been taking diuretics on a long-term basis. Which findings should the nurse expect to note as a result of this long-term use? 1. Gurgling respirations. 2. Increased blood pressure. 3. Decreased hematocrit level. 4. Increased specific gravity of the urine. The correct answer is 4. Increased specific gravity of the urine. Rationale. Clients taking diuretics on a long-term basis are at risk for fluid volume deficit. Findings of fluid volume deficit include increased respirations and heart rate, decreased central venous pressure, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, increased specific gravity of the urine, dark-colored and odorous urine, an increased hematocrit level, and an altered level of consciousness. Gurgling respirations, increased blood pressure, and decreased hematocrit as a result of hemodilution are seen in a client with fluid volume excess. Question 5. The nurse reviews electrolyte values and notes a sodium level of 130 milliequivalents per liter. The nurse expects that the sodium level will be noted in a client with which condition? 1. The client with watery diarrhea. 2. The client with diabetes insipidus. 3. The client with an inadequate daily water intake. 4. The client with the syndrome of inappropriate secretion of antidiuretic hormone. The correct answer is 4. The client with the syndrome of inappropriate secretion of antidiuretic hormone. Rationale. Hyponatremia is a serum sodium level less than 135 milliequivalents per liter. Hyponatremia can occur secondary to SIADH. The client with an inadequate daily water intake, watery diarrhea, or diabetes insipidus is at risk for hypernatremia. Question 6. The nurse is caring for a client with leukemia and notes that the client has poor skin turgor and flat neck and hand veins. The nurse suspects hyponatremia. Which additional signs/symptoms should the nurse expect to note in this client if hyponatremia is present? 1. Intense thirst. 2. Slow bounding pulse. 3. Dry mucous membranes. 4. Postural blood pressure changes. The correct answer is 4. Postural blood pressure changes. Rationale: postural blood pressure changes occur in the client with hyponatremia. Intense thirst and dry mucous membranes are seen in clients with hypernatremia. A slow, bounding pulse is not indicative of hyponatremia. In a client with hyponatremia, a rapid, thready pulse is noted. Question 7. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 milligrams per deciliter. Based on this laboratory value, the nurse should take which action? 1. Document the value in the client's record. 2. Inform the charge nurse of the laboratory value. 3. Place the laboratory result form in the client's record. 4. Reassure the client that the laboratory result is normal. The correct answer is 2. Inform the charge nurse of the laboratory value. Rationale: the normal serum calcium level ranges from 8.6 to 10.0 milligrams per deciliter. The client is experiencing hypercalcemia, and the nurse will inform the charge nurse of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. Question 8. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which sign/symptom is an indication of this electrolyte imbalance? 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness. Rationale: generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. Question 9. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium? 1. Milk. 2. Butter. 3. Spinach. 4. Collard greens. The correct answer is 2. Butter. Rationale: butter comes from milk fat and does not contain significant amount of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet. Question 10. The nurse is caring for a client with hyperparathyroidism and notes that the client's serum calcium level is 13 milligrams per deciliter. Which prescribed medication should the nurse prepare to assist in administering to the client? 1. Calcium chloride. 2. Calcium gluconate. 3. Calcitonin. 4. Large doses of vitamin D. The correct answer is 3. Calcitonin. Rationale: the normal serum calcium level is 8.6 to 10.0 milligrams per deciliter. This client is experiencing hypercalcemia. Calcium gluconate and calcium chloride are medications used for the treatment of tetany, which occurs as a result of acute hypocalcemia. In hypercalcemia, large doses of vitamin D need to be avoided. Calcitonin, a thyroid hormone, decreases the plasma calcium level by inhibiting bone resorption and lowering the serum calcium concentration. Question 11. A client has the following laboratory values: a pH of 7.55, an HCO3 level of 22, and a PCO2 of 30. Which action should the nurse take? 1. Perform Allen's test. 2. Prepare the client for dialysis. 3. Administer insulin as prescribed. 4. Encourage the client to slow down breathing. The correct answer is 4. Encourage the client to slow down breathing. Rationale: the client is in respiratory alkalosis based on the laboratory results of a high pH and a low PCO2 level. Interventions for respiratory alkalosis are the voluntary holding of breath or slowed breathing and the rebreathing of exhaled CO2 by methods, such as using a paper bag or a rebreathing mask as prescribed. Performing Allen's test would be incorrect because the blood specimen has already been drawn and the laboratory results have been completed. Dialysis and insulin administration are interventions for metabolic acidosis. Question 12. The nurse is told that the blood gas results indicate a pH of 7.50 and a PCO2 of 32 milligrams per deciliter. The nurse determines that these results are indicative of which acid-base disturbance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 4. Respiratory alkalosis. Rationale: the normal pH is 7.35 to 7.45. In a respiratory condition, an opposite relationship will be seen between the pH and the PCO2, as is seen in the correct option. In an alkalotic condition, the pH is increased. In an acidotic condition, the pH is decreased, so both metabolic acidosis and respiratory acidosis can be eliminated. Metabolic alkalosis can also be eliminated because both pH and HCO3 are increased above normal values in this condition. Question 13. A client is scheduled for blood to be drawn from the radial artery for an arterial blood gas determination. The nurse assists with performing Allen's test before drawing the blood to determine the adequacy of which? 1. Ulnar circulation. 2. Carotid circulation. 3. Femoral circulation. 4. Brachial circulation. The correct answer is 1. Ulnar circulation. Rationale: before performing a radial puncture to obtain an arterial specimen for ABGs, Allen's test should be performed to determine adequate ulnar circulation. Failure to assess collateral circulation could result in severe ischemic injury to the hand if damage to the radial artery occurs with arterial puncture. The remaining options are not associated with this test. Question 14. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Metabolic alkalosis. Rationale: the loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. Question 15. The nurse is caring for a client with severe diarrhea. The nurse monitors the client closely, understanding that this client is at risk for developing which acid-base disorder? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 1. Metabolic acidosis. Rationale: intestinal secretions high in bicarbonate may be lost through enteric drainage tubes, an ileostomy, or diarrhea. The decreased bicarbonate level creates the actual base deficit of metabolic acidosis. The remaining options are unlikely to occur in a client with severe diarrhea. Question 16. The nurse is caring for a client with diabetic ketoacidosis and observes that the client is experiencing abnormally deep, regular, rapid respirations. How should the nurse correctly document this observation in the medical record? 1. Apnea observed. 2. Brady noted. 3. Shane-Stokes demonstrated. 4. Kussmaul's respirations observed. The correct answer is 4. Kussmaul's respirations observed. Rationale: abnormally deep, regular, and rapid respirations observed in the client with diabetic ketoacidosis are documented as Kussmaul's respirations. In apnea, respirations cease for several seconds. In Brady, respirations are regular but abnormally slow. Shane-Stokes respirations gradually become more shallow and are followed by periods of apnea with repetition of the pattern. Question 17. The nurse is caring for a client with diagnosis of chronic obstructive pulmonary disease, COPD. The nurse should monitor the client for which acid-base imbalance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 3. Respiratory acidosis. Rationale. Respiratory acidosis most often occurs as a result of primary defects in the function of the lungs or changes in normal respiratory patterns from secondary problems. Chronic respiratory acidosis is most commonly caused by COPD. Acute respiratory acidosis also occurs in clients with COPD when superimposed respiratory infection or concurrent respiratory disease increases the work of breathing. The remaining options are not likely to occur unless other conditions complicate the COPD. Question 18. When caring for the following group of clients, who does the nurse determine is at risk for development of metabolic alkalosis? Select all that apply. 1. Client with emphysema. 2. Client who is hyperventilating. 3. Client with chronic kidney disease. 4. Client who has been vomiting for 2 days. 5. Client receiving furosemide Lasix, 40 milligrams daily. 6. Client admitted with acetylsalicylic acid, aspirin, overdose. The correct answers are for client who has been vomiting for 2 days and 5. Client receiving furosemide Lasix, 40 milligrams daily. Rationale. Metabolic alkalosis is caused by any condition that creates the acid-base imbalance through either an increase in bases or a deficit of acids, such as a client who has been vomiting for 2 days and the client receiving furosemide daily. Recall that clients with emphysema and hyperventilation are at risk for a respiratory acid-base disturbance. Chronic kidney disease and aspirin overdose will result in metabolic acidosis. Question 19. The nurse is caring for a client with respiratory insufficiency. The arterial blood gas results indicate a pH of 7.50 and a PCO2 of 30, and the nurse is told that the client is experiencing respiratory alkalosis. Which additional laboratory value should the nurse expect to note? 1. A sodium level of 145 milliequivalents per liter. 2. A potassium level of 3.2 milliequivalents per liter. 3. A magnesium level of 2.4 milligrams per deciliter. 4. A phosphorus level of 4.0 milligrams per deciliter. The correct answer is 2. A potassium level of 3.2 milliequivalents per liter. Rationale. Signs/symptoms of respiratory alkalosis include tachypnea, mental status changes, dizziness, pallor around the mouth, spasms of the muscles of the hands, and hypokalemia. The remaining options identify normal laboratory results. Question 20. The charge nurse reviews the results of the arterial blood gases with the staff nurse and tells the nurse that the client is experiencing respiratory acidosis. The staff nurse should expect to note, which on the laboratory result report: 1. pH 7.50, PCO2 52. 2. pH 7.35, PCO2 40. 3. pH 7.25, PCO2 50. 4. pH 7.50, PCO2 30. The correct answer is 3. pH 7.25, PCO2 50. Rationale. The normal pH is 7.35 to 7.45, and the normal PCO2 value is 35 to 45. In respiratory acidosis, the pH is down and the PCO2 is up. Therefore, the option with the pH of 7.25 and the PCO2 of 50 is the only option that reflects an acidotic condition. Options with an elevated pH indicate an alkalotic condition. Option 2 identifies normal values for pH and PCO2.
You can check out my study guides and reviews. Links will be in the description. Thank you for watching.